Hello and welcome to the Performance Management and Quality Improvement Plan presentation. This is also known as PMQI. I'll be running you through the basics of this plan, as well as the purpose of this plan, and really the importance of PMQI within the health department. Now, the aim of PMQI is to enhance performance-driven workflow, as well as the culture thereof amongst the leadership, the management, and the staff to achieve meaningful program results. Right? And these results hopefully align with our upper level goals as well as our SMART objectives. Now, with monitoring, evaluation, and refinement, we are already doing this, but chances are it's not formalized. We do monitor the quality and the quantity of our work, but now we want to evaluate our work. We want to refine things. So to elaborate on this concept of elevating excellence, we have to formalize things. So you may have seen this diagram of the funnel of health, maybe from the previous presentations within this series. And in this framework, the left side of the inverted pyramid, this side, outlines foundational documents created across levels. So these are our foundational documents. And it ultimately establishes agreed upon goals and SMART objectives. The left side is also known as the plan side, right? So plans about our goals and our objectives. And to ensure vertical alignment, the SMART objectives at one level become the goals at the next lower level. And this promotes consistency throughout the organization. The PMQI plan also operates on the division program level, and it determines specific actions based on our SMART objectives from the health department level. So within the PMQI plan, our SMART objectives are referred to as performance standards. And really what this plan is meant for is to detail what needs to be done to create a strong system for improving our projects and the quality of our projects. We do that by setting standards, gathering data, analyzing the data, and also reporting our findings to provide a means or a starting point for refinements. Now, the right side of the inverted pyramid illustrates how achieving goals at one level contributes to completing SMART objectives at the next higher level. This is also known as the do side. Are we doing the work? Are we completing what we need to complete? And everything in red, again, is our foundational documents. All right, so we have established that this is a FAB measure. It's part of the set of foundational documents along with the CHA and the CHIP and the strategic plan and the workforce development plan. But the PMQI plan is about evaluation. Making the necessary improvements, measuring our work, measuring our daily actions. It's about whether we're meeting the action plan, and if we're not, it becomes about figuring out what and how we can do better. So really a big part of the PMQI process and plan is to advance our performance for all Cattaraugus County Health Department leadership, management, and staff, but also across the divisions. We want to be able to achieve meaningful and measurable program results. So I wanted to provide a bit of context here. Now, the health department has a strategic plan, of course, and this plan has, firstly, a mission statement, which I added here. Derived from this mission statement, we have our goals, along with their respective SMART objectives, right? Now, these SMART objectives feed the action plan. They're really the connection between the strategic plan and the action plan. And to achieve our objectives, we have to have an action plan. This is really where all of the PMQI stuff come in. So to understand performance management and quality improvement, we have to recognize that there are two sides to this, right? So we have our performance management side, and we have our quality improvement side. And performance management is about tracking things, while quality improvement is about when that action plan is not getting done. Now, performance management involves a lot of strategic planning and decision making, and every division already does PMQI, right? It's just not being written, it's not formalized. Managers and supervisors in their head or behind the scenes, they evaluate their staff and their work, whether it's work amounts or quality. They evaluate their department as their staff work towards their goals and their objectives. So they probably know what they're doing and what they need to do to improve, meaning everyone's doing their job. But it's not formally being tracked. And even though we are probably discussing ways to improve processes, we haven't formalized those ideas and those plans. And that's what performance management is about. It's about that action plan, which again is about getting the work done. Now, performance management is also about data-driven decision-making, right? That's facilitated through performance management. We also want to have a clear goal alignment, because having a clear goal alignment ensures that our efforts are contributing to the overarching mission. Now, when it comes to resource utilization, we're really dealing with efficacy. We want to know ideally how much effort, resources, are going into those goals. And that allows the health department to assess both individual and team performance and ensure efficient use of limited resources. Now, something I didn't put up here is the performance management culture that it creates, right? So PM fosters this culture of continuous improvement by providing regular feedback. We're promoting learning. We're holding individuals accountable for their responsibilities. So it creates or contributes to professional development because we're refining our best practices. So there ends up being this sense of organizational accountability. Also, with performance management is regular assessments. And although this is a commitment, it does create a dynamic that's focused on achieving and exceeding organizational objectives. Now, if the action plan does not get done, that's where QI comes in. And this is what accreditation requires to be formalized. They want to know that we are keeping track of things, and they want to know what we are doing to keep track of those things. So there are a couple of concepts we want to think of when it comes to quality improvement. First, we want to reduce errors. This means identifying and addressing potential steps, whether it's regarding safety or efficacy. We want to address those steps through continuous monitoring and improvement. We also want to improve workflows, or like I used to say, boost productivity. This not only improves efficiency, but it also contributes to the cost effectiveness, right? Because we're eliminating unnecessary steps. We're refining steps to enhance the overall workflow. It's also about training and learning, right? So quality improvement really does foster this culture of continuous learning. Staff members are encouraged to engage in ongoing education, training, professional development, and this ensures that the organization remains adaptive and responsive to the evolving healthcare practices and standards. So just a couple of performance management basics. First, we want to ask ourselves whether our ongoing activities are contributing to meeting performance standards. Now, note the language here. So SMART objectives are often referred to as performance standards. However, in our performance management software system, so VMSG, we'll be using SMART objectives. Second, we want to know if there are any problems associated with either the quality or the quantity of our work and need attention. And then we want to know what workflows meet our performance standards. We want to know that because we could potentially discuss ways in which, other processes could work with this as a model. So these SMART objectives are developed at the division program level, so really by the division managers, and this cycle puts it into perspective pretty well. So our first question should be, where are we now and where do we want to be, right? Our results and our standards. Our measurements is about how we would know. Are we moving towards where we want to be? And then third, how are we doing, right? Are we making progress towards those SMART objectives? And lastly, how are we going to improve? So now we have concluded what is working and what isn't. And with the quality improvement step, we are really establishing ways in which we can improve the processes in need of refinement. And this entire cycle is, facilitated by a performance management software system, which in the case of Cattaraugus County Health Department is VMSG. Now, within our first step of the cycle, that being results and standards, It's important to note that the performance standards, our goals, and our SMART objectives, they stem from national and state guidelines, and they are divisional. For example, environmental health, they may have stipulated goals and objectives already coming from national guidelines, where other divisions are left to establish those themselves. And within results and standards, we also want to communicate those expectations, right? That's an important part of this first block, if you will. We want to communicate how are we getting from point A to point B. And this is all documented, or should ideally be documented, in our performance management software system. So really, the two important concepts to remember with results and standards, we want to identify and select our goals, our SMART objectives, and we also want to communicate our expectations for those goals and those SMART objectives. And now we're at performance measurement. So I want to make a quick note here again regarding the language. Some may use the language measures and indicators, while we use goals and objectives. And with PMQI in Cattaraugus County Health Department, we want to be using the same language. So for that, we're going to be using goals and objectives, and that's also how it's used in VMSG. So we're keeping things simple here. But with measurement, we are ultimately collecting data. So I'm going to show you what it looks like in VMSG. First, we have our goals, we have our objectives, and we have our activities. And we're currently at the activities level. This could also be seen as the action plan. And for this example, one of the activities is to post quarterly reports. And here we can really see. So we want to be able to post 4 quarterly reports by October 3rd. And our performance metric, our measurement, is, it's measured quarterly, and our goal is to get all 4 reports in by this date. So green would be the 4, yellow would be anything between 1 and 4, and then red would be anything less than 1. Now, with measurement, we are ultimately collecting data, right? Did we get all 4 reports in? We want to be analyzing that data. What prevented us from getting all 4 reports in? And then we're refining that process. So do we need to change the timeline? Are 4 reports excessive or even necessary? And that's all what measurement is about. So now we're at the third block, which is monitoring and communication progress. And this is all about reporting our progress and then analyzing that reported data. Now, with reporting our progress, this is really about knowing how and if we are meeting our performance standards. We also want to know whether we are making progress on our performance measures. And then we want to establish our feedback channels or mechanisms. Are the updates and the information getting to who it needs to get to ensure that the needed changes or corrections or refinements are being made? And when it comes to analyzing reported data, we want to know whether we are making progress, right? Because if we're not, we have to move on to the next step, which is quality improvement. With this, we also want to conceptualize or be able to better conceptualize our workflows, and that's to identify opportunities for improvement. Now, all of this is facilitated by our performance management and software system, VMSG. If you have read or plan on reading the PMQI plan, the full documents, which I would encourage everyone to give it a read. Chris put a lot of effort into that, and it's a really well-written document of the PMQI within Cattaraugus County Health Department. But it dives deeper into what I'm talking about in this presentation. And you'll notice it mentions the PMQI committee. Now, the PMQI committee, these are individuals that ideally would discuss areas of progress, next steps, and opportunities for improvement. In the cases where program performance measures have shown no positive change, and therefore, no progress has been made on reaching the given performance standard, the PMQI committee, along with divisional staff, would work on developing an appropriate quality improvement project. This, again, ideally is what we hope for and want from the PMQI process. This brings us to the last step of the PMQI process, which is quality improvement. Now, quality improvement can ultimately be seen as this feedback loop, right? And the feedback loop is triggered by the program's lack of progress in meeting performance standards. This is, of course, according to the chosen performance measure. Now, essentially, when progress to meeting performance standards is slow, there may be a need for implementation of a quality improvement strategy. And Cattaraugus County Health Department's quality improvement process involves this plan, do, check, act model or cycle. This is also recommended by the Public Health Foundation. Now, in this model, plan involves investigating the current situation, right? Understanding the nature of performance challenges and the development of potential strategies for addressing those challenges. It's also about detailing the actions to be taken to address those challenges. And when it comes to do, this involves completing the actions associated with, implementation or implementing the decided strategy, and collecting any data or any information associated with issues that may occur during implementation, as well as lessons learned along the way. Now, when it comes to the check step, which is also sometimes referred to as study, this is where we want to analyze how the performance measures or a given measure have changed as a result of the actions taken. We want to document those changes. And then finally, we get to the act step. This is where we either want to adopt an action, maybe reject an action, or even adapt to the actions that were taken depending on what was learned. Performance continues to be measured in this step. And the plan, do, check, act cycle or process could potentially begin all over here. And that would be if performance does not improve as desired. Now let's dive a little deeper into the plan, do, check, act approach. We want to know how this looks like within Cattaraugus County Health Department. So first, with the performance management data being interpreted and analyzed, this is technically not a part of the QI improvement process, but the step does examine both quantitative and qualitative data or information that may be reported to Cattaraugus County Health Department staff. And in this step, the data and the information may reveal an issue associated with a performance standard that should be addressed. Anyone within the department can perform data and information analysis as well as interpret it to identify potential issues. Now, if it is determined that there is a need for a quality improvement project after analysis and interpretation of data, the individuals most familiar with performance standards, measures, and workflows, most likely the division managers and supervisors, but with input from the staff, would determine the need for a QI project. In making this determination, those involved should consider the magnitude of the issue to potentially be addressed. They should have a rough estimate of the resources needed to address the issue, and they should also understand and communicate the benefits associated with, increasing a given performance. The third step is where a quality project team is, chosen or decided upon. And the team may consist of not only Cattaraugus County Health Department staff, but also outside staff from other agencies, clients, or program stakeholders. Now, our fourth step is where we identify the drivers of poor performance. Here, the aim is really to develop a conceptual model on how the current process or workflow operates. So we want to collect the needed data and information to identify why performance is poor. Poor performance within PMQI is really just, the failure to meet a SMART performance measure. But it contributes to meeting a given performance standard. Now, we may want to consider, obtaining baseline data, creating a data collection plan to assess an existing process or workflow. We may want to identify the barriers to improved performance. And then step number 5 is where we want to consider options for, improvements and develop the QI project proposal. Once we have identified the drivers of poor performance, the quality improvement project team, if you will, would consider options designed to increase performance. And in doing this, the team should consider project costs, implementation logistics, the ease of data collection, and also the time frame of implementation. Now, step number 6 is ultimately the approval of the QI project. So the majority of QI projects will occur at the division or program level within the health department. For those specific divisional projects, the division manager would have the final approval of a given project, and they would inform the PMQI committee upon approval and ensure that data are collected appropriately to demonstrate the results of the project. Now, where a QI project affects multiple divisions or agencies outside of the department, the public health director would have final approval. Our 7th step is our software system data entry. Here, the Performance Management Quality Improvement Committee would work on or with QI project staff to ensure that all the necessary data regarding the QI project is entered into the software system, so VMSG. And this data entry would include, completion dates for the project itself, as well as any identified important milestones. Block number 8 is the implementation of the QI project. Now, here, the QI team would already have identified the steps necessary for completion of the QI project, and they may have established the resources necessary for project completion. Using the resources identified and following the steps for project completion, the QI project team would begin implementation of this project. And this would likely involve changes to existing workflows and therefore most probably require staff training. The second to last step is about analyzing and interpreting, implementation data that we have collected. And here we're really looking at the data we've already collected. This data should be about the project or how the project is affecting performance measures. It should also be about the resources it's using and how or if there is any impact on other workflows. We don't have to analyze every detail, but we do want to or need to be able to draw conclusions about how well the improvements are working. And then the final step is deciding on the final project status. This is where the team would complete and submit the QI project or the reporting form. They would submit it to the PMQI committee, and this form would include the QI project team's recommendation on adoption, rejection, or refinement of the process with the QI project. And then the PMQI committee would evaluate the report and continue further steps on the submission of the report along with any of their final recommendations. And again, this is all facilitated by VMSG. VMSG is where we input and store this information as well as the results. And VMSG also allows us to input these results in writing and on websites, or in writing that we can then post on websites. So if you are a division manager and supervisor or a staff member, you may be wondering what this looks like for you within Cattaraugus County Health Department. And in general, division managers and supervisors are the ones setting this up. They're the ones deciding on the performance standards, tracking it through our software system, which is VMSG, encouraging training where needed, deciding on whether quality improvement initiatives are needed, and then also communicating feedback appropriately. Staff, alternatively, are the ones collecting the data, potentially identifying valid performance measures, and also participating in the decided upon quality improvement projects. So as a final statement, PMQI is crucial to the development and the overall performance and performance culture of an organization. It encourages this drive for continuous improvement, continuous growth, development within the organization. So other than the fact that it's a FAB requirement, it does enhance organizational effectiveness. Thank you. And just as a note, our contact information, so Christopher Crawford, who wrote the PMQI plan at the top there, and my contact information at the bottom. And we thank you very much for watching.